The primary endpoint was the so-called major disability-free survival, and after 2 years. And this is important in so far that survival doesn't mean a lot. I mean, if these patients are maximally deteriorated, they can still survive and have a poor quality of life. And the major goal to also demonstrate effectiveness is to avoid any major neurological dysfunction, which, for instance, might affect walking or hearing or vision or swallowing. And all these should be avoided by an effective therapy. And it also turns out from looking at transplant outcomes that these events are at a much earlier and much better to predict than just survival. So survival without these disabilities is a very good endpoint to measure effectiveness. The other endpoints were also, I mean, they were of course being without any other, not major, but other neurological dysfunction, and also the LES score, what I already mentioned, a measurement of degree of brain demyelination, whether that stays constant or not. So that were other secondary endpoints. With regard to safety, this was on one hand graft versus host disease, which is maybe not perfect, but it is to be shown. I mean, this is an autologous therapy. You would not expect to develop graft versus host disease. More meaningful is engraftment. So this is a myeloablative approach. We destroy all the existing unmanipulated marrow and replace it by this gene product. And for that, it's of course very important that this modified gene product, which may show some myelotoxicity, the virus itself, that this is engrafted, that you get hematopoietic reconstitution again. So that was one very major safety endpoint, and all these patients met these endpoints, and all patients engrafted. And the other also, of course, very important endpoints, safety endpoints were or the question whether there are any infectious particles and whether there develops insertional oncogenesis. The 20 of 23 patients met the primary endpoint and are transferred to the long follow-up observational trial, and it expected that the 9 others who are still okay and did not develop any major disabilities will also be transferred. So one thing is, of course, the aspect long-term safety and long-term effectiveness. There is also what we reported here at the EBMT, a second study which employs a different conditioning regimen, and in addition to confirm safety aspects and general effectiveness, one of the goals is of course to see whether another different conditioning might offer any advantages. It's still too early. As of last data cut, these 13 patients were still only had a maximum follow-up of 6 months. So for effectiveness, it's still too early. And then, of course, I don't think this is a secret that marketing approval will be looked for in the near future. And this is, of course, also from the clinician point of view, really desired that we have an alternative to allogeneic stem cell transplantation. Again, especially for these patients who lack well-matched donors.